Chali. 1, 2, 3. Go like.
A very good afternoon to everyone who has joined our Facebook Live session today. We have with us Dr. C. Lennon, consultant knee replacement and arthroscopic surgeon, Apollo Hospitals, Greaves Road, who has to his credit more than 4,000 minimal invasive sub-vastus total knee replacements and 9,000 therapeutic arthroscopic surgeries of knee and shoulder. He is one of the very few in the country to have rich experience in both arthroscopic and joint replacement surgeries of the knee and shoulder. This enables him to provide holistic treatment to knee and shoulder problems. We are very happy to have you with us, Doctor. So our first question for this session would be the basic question: what is ideal knee replacement surgery?
Well, ideal knee is not a ready-made knee which is available on the shelf to be used. It is a concept, it is a philosophy which I have evolved almost over 2 decades of my practice in this field, which we will talk more about it.
So could you please tell us about the several reasons that can cause knee pain today?
Well, see, the knee pain can be caused for elderly people due to arthritis, which we all are aware of. Above the age of 50, 60, due to aging, the cartilage inside the knee degenerates and it gives rise to what is called degenerative arthritis or arthritis due to aging, which is manifested with pain, stiffness, and loss of function with the knee. But even the knee pain nowadays we see very commonly in the younger population also due to various injuries. They can have a meniscal injury or a ligament tear or even primarily a traumatic injury to the cartilage. So all this can lead to pain in the knee.
So could you please tell us about the difference between ideal knee replacement surgery and total knee replacement surgery?
Yeah. So see, the word I coined as an ideal total knee replacement, it has a long history to it. When I started doing knee replacements 20 years back, we could provide we could do a knee replacement and relieve the pain of the knee for the patient, but the patients were not happy with the procedure due to various reasons. I would say, if you implant the knee, it was not lasting for longer time. It could last only for 8 to 10 years. And also, the time which they took to recover from the procedure was quite long. They were struggling almost 6 months to a year to completely get to their normal day-to-day activities. So, we have to work on the patient's expectations. So we used to search and provide them, answer for each and every concerns of the patients. So what I would say, I was, fortunate enough to be always on the forefront of the technology. I was one of the, key persons in introducing the computer navigation in total knee replacement to this country. So when we came out with that, we were able to accurately implant or house the implant inside the knee with zero error, and which definitely saw to the long-term survival of the implant. And then I still felt the recovery after the surgery was taking quite long, and I evolved this sub-vastus approach. So it is an approach or the surgical technique wherein the muscles are not at all cut in front of the knee. If you see, after this knee replacement, what is most important is the strength of the muscles which are in front of the thigh. We call them as quadriceps. So a conventional knee replacement, rightly you asked, is performed by cutting through this quadriceps muscle, and it is sutured back after the procedure. So when the muscle is cut, the patients take long time, to recover from the surgery because the strength in the muscle goes down. Whereas in ideal knee replacement, we use the sub-vastus approach, where literally the quadriceps is preserved. We only cut the skin and then we preserve the muscle. We don't cut the muscle. After making the incision on the skin, we enter in and we preserve the entire quadriceps. We don't cut the quadriceps. So that helps the patients to recover much faster after the procedure. Say in 15 days to a month time, they're almost normal and they're able to get back. So modifying the approach, getting a good implant, and as well as implanting it with 0-degree error. So all these things together, gives an advantage, and that's why I coined it as ideal knee replacement.
So doctor, like you had just mentioned, the sub-vastus approach. In short, could you please tell us what the sub-vastus approach exactly is? And does this method use a computer-assisted method of treatment?
Well, yeah, sub-vastus approach is basically, as I was, discussing, it is a surgical approach. A computer navigation doesn't help in the surgical approach. Basically, it helps in implanting the, artificial knee inside. So, sub-vastus approach, to be precise, it preserves the quadriceps muscle. That is the muscle which is in front of the knee, which is very important for the patient to recover after the knee replacement. So in a sub-vastus approach, the quadriceps is preserved, it is not cut. Whereas in a conventional surgery, the quadriceps is cut, and because of that, the patient develops weakness in the muscle and they struggle to come out of the procedure, and they take long time to recover. Whereas in the sub-vastus approach, the muscle is completely preserved. So in 10 to 15 days time, they're able to walk normally and get back to their activities very quickly.
So how long does the surgery procedure take, doctor?
Well, it is like any other knee replacement. It takes 45 minutes to an hour.
So what would be the clearly visible possible benefits of an ideal knee replacement surgery?
Yes. So if you ask me about the benefits, one, I would say the immediate benefits are the pain is going to be very negligible, and the recovery is going to be much faster. Say in 15 days time to a month time, the patients will be able to do their activities. And in a long term benefit, if you see, the implant which I am using in this ideal knee replacement is a rotating platform implant, which we will discuss in detail further, which increases the survival of the implant. So when there is a quicker recovery and a long-term survival of the implant is assured to the patient, I don't see any other great benefit can be given to them.
So like you had just mentioned implant, doctor. So what pieces are used in the knee replacement and how are they kept in place?
Good. So you see, a conventional knee replacement is performed with a fixed platform knee implant. See, a fixed platform means the cushion or the specialized polyethylene is fixed to the implant, which goes on the leg part. That's the tibial aspect of the knee, and this cushion is fixed to the tibial platform. It cannot move. So when a patient is walking, they can only move the knee in one direction. There is no rotations which are allowed. In fact, if you see in the normal knee, not only the movements are in this direction, but there is little bit of a rotational mobility also is present, but which is not possible with the fixed platform. And when there is a rotational forces are exerted, these forces will go to the implant and the bone junction, and they tend to work out slowly. So that is why you need a redo surgery after 10 or 15 years in this case. Whereas when you use a rotating platform, as we are using in the ideal knee replacement, here you can see the polyethylene is free to rotate. It is not fixed to the implant, and because of this allows the patient the normal rotational movements which are present in the knee, and also the forces are not taken to the implant and the bone junction. And this has a proven record clinically as well as in the laboratory studies. And this is going to last definitely a decade longer than the conventional knee.
That was very informative, doctor. Thank you. So now when we look at the uh, replacement surgery, what happens in a pre-operative evaluation, and how is a patient's physical condition evaluated prior to the ideal knee replacement?
Well, see, I would say here there is no big difference between pre-operative evaluation of a patient in ideal knee replacement surgery and a conventional knee surgery. Any patient who is waiting total knee replacement can be considered themselves as fit to take up this procedure.
So, like you had mentioned, anyone would be fit. So, we have a question. Someone has mentioned saying, my brother had a total knee replacement surgery done. He is 58 years old, but it took him about almost a year to recover. So, why was that?
Well, it is a classical question what you're asking. Even many of my patients say, doctor, even before undergoing this procedure, we were afraid of so much problems post surgery. We never thought it is going to be so easy for us after the procedure. I'm trying to convince so many patients who are really in need of this procedure. So that has the answer. When a surgery is done in a conventional way, the patients are always worried of the post-operative events. Like they will have a lot of pain for quite a few months continuously, and the recovery, from the surgery takes quite some time for them, because the one fact, the muscles in front of the thigh, there's a quadriceps, is cut open in the conventional surgery, which is absolutely spared in this ideal knee replacement concept. So that gives a huge difference for these patients. So when it is done this way, in the in the way of ideal knee replacement, definitely they will be enjoying the procedure.
So, another question about the age. So, here is one person who's asked, I'm 51 years old. Am I eligible for an ideal total knee replacement?
Well, that's a good question. Like, it's exactly what I'm trying to say, because I showed you the difference between how a fixed platform works and how a rotating platform works. And these rotating platform implants have a proven track record. I did mention that clinically as well as in vitro studies, in laboratory studies, that they last longer. See, when a patient comes to us in the younger age group, say 10 years, 15 years back, we would have refused them, because we all know these implants, once it is done, it is going to last only 10 years or maximum 15 years. But with this rotating platform implants, and also the new technologies which are infused into it, because we have now the latest technology of producing a different type of polyethylene also. So these implants are known to last more than 25-30 years. So a younger patient, 51, who may not be fit for a conventional knee replacement, but he will be very much be able to undergo a ideal knee replacement.
So, while considering recovery, does the recovery differ for men and women?
Well, see, I won't say that there's a huge difference, as far as the sex is considered. But of course, it depends on how fit you are. If your muscles are good, you tend to recover fast. Whether men or women, it depends on their pre-operative muscular strength.
So, doctor, from what you've said, we get it that an ideal knee replacement is very advanced and quite helpful. But what are the possible surgical complications, if any, that can crop up? How would that be handled?
Well, I would say ideal knee replacement per se doesn't have any specific complications tied to the procedure. It is like any other knee replacement procedure, whatever complications can happen. That's a common thing which can, but we have all the technology and expertise to avoid. And I have successfully done thousands and thousands, and in our hands, the complications are almost zero, you can say.
So, doctor, just to clarify this again, So, is ideal knee replacement painful? And if so, how does one have to prepare for this surgery?
Okay. See, the ideal knee replacement, I won't say it is completely a painless procedure. What I'm trying to convey is, with this technique, the pain is going to be less and the pain episodes will get over very soon. But of course, the procedure is done under anesthesia, so it is pain free. And even after the surgery, we tend to keep the patients absolutely pain free with the help of our anesthetic colleagues who have, state of the art technology helping them.
So, how would one evaluate when it is the right time for them to undergo a knee replacement?
See, that's again another good question. See, some say that, oh, my life is gone, I'm almost crippled and I'm bound to my wheelchair, but I'm only 50 years, so I'm waiting to become 60 to undergo the procedure. So age is not an indication or a contraindication. So the oldest patient whom I would have operated is 95 years. It is not because he is 95 we refuse them, because he looks 70, physiologically he looks 70 and he leads an active life, healthy life. So we offer them the surgery. So age is not an indication or contraindication for this procedure. So when one should submit themselves for this procedure is the symptoms. It's based purely on the symptoms. When your pain disturbs you even at rest, you're not able to sleep well, it disturbs your day-to-day activities and you feel you're losing the quality of life, and even with assistance of mild pain medications, your pain is not disappearing, I'm sure that is the time you should think about this surgery. And again, I would like to add on, when the arthritis advances, this is the only way you can get cured.
So, psychologically, doctor, how does one have to approach an ideal knee replacement surgery?
Well, I would say you can always keep it in your mind, this is going to be a patient-friendly procedure. It is not necessary for you to be afraid of the events that are going to happen after a conventional knee replacement in the post-operative period. I can assure them that they can expect an easy and faster and quicker recovery.
Now, someone has asked us, what will happen if I prolong the surgery?
Like avoiding the surgery.
Yes.
Yeah. See, if you tend to avoid the surgery, still it happens. Not that everybody who sees us with the disease with the real indication doesn't come under the knife. They always have certain prejudiced ideas and restrictions and reservations. When you prolong the surgery, I'm sure your quality of life will go on. And second thing, you're going to suffer with pain. That is the most important thing. You are going to suffer with pain, and to overcome that, you will try to do various treatments which are not going to help. People take a lot of pain medications that ends up damaging their kidneys. So it is endless. They are going to suffer. They are going to suffer, and ultimately they are going to become wheelchair bound.
So, doctor, here is another question. Will I have a surgical wound? And if so, how do I take care of my surgical wound?
Yes, of course, because there is going to be a surgical wound when we do a knee replacement. Of course, when the patients are discharged from the hospital on the third or fourth day, it is covered, and usually we give them a water resistant dressing, and it is not necessary to change the dressing often. When they come on the next visit for the clip removal, it is automatically taken care.
So, while you had just mentioned and also mentioned before, doctor, to reiterate once more strongly, how long would one be expected to be in the hospital, and how long would the recovery process be?
Well, see, in case of ideal knee replacement, the patients can go home even on the third day, and usually ninth or 10th day we remove the skin staples or the sutures, and in 2 weeks I expect them to walk at least a kilometer or two, and in a month time they are back to their regular activities.
So, that covers quite a few of the next couple of questions we had, doctor. So, now while one is at home, how should they prepare for being at home after the surgery?
Yeah, that's right. See, here, as I told, the recovery is going to be faster and quicker after ideal knee replacement. You don't need to really, have some separate arrangements at home after going back. All that they have to do is like they have to walk with a walking aid, walker or a crutch for 10 days, and that's it.
So just to extend this question, so what will be the kind of activities they can engage in over a period after the surgery?
Well, yeah. So usually we advise initial 10 days they should be restricted. There are, within the house, and after 10 days they can slowly start walking at least half a kilometer to a kilometer every day, and they can, start with the static cycling, and if they want to swim, they can swim. But only thing, the restrictions are going to be like they can't sit on the floor crossed, and they can't squat. So these two are restricted, and it's for a lifetime.
Okay, so just to again go back to the question, how long will the mobility or movement restrictions or limitations last? Depend on what it is and at what stage after the surgery.
Yeah, so see, I would say, following an ideal total knee replacement, a patient will have unlimited activities. They can stand for any hours, and they can walk any longer distance. The restrictions, as I told, are only going to be they should not sit on the floor with legs crossed, and they are advised not to squat, and that's going to remain forever, for their lifetime. Apart from that, they can have, they can do whatever they want.
So, what would be the pre-operative and or post-operative information one would need to know in terms of work, exercise, and personal care?
Well, see, if you ask me for a conventional total knee, that's a big preparation. Patient has to be mentally prepared for the procedure, and they have to expect a very long recovery, painful recovery, I would say. But in case of an ideal, knee replacement, I would say they can, all this is not necessary, because they are going to get all right in 10 to 15 days time.
So, what kind of follow-up is required after the procedure?
Yeah. So they go home on the third or fourth day, and then we see them on the 10th day for the skin sutures or staple removal. And the next follow-up should be in a second month, and thereon we see them once in a year or two.
So, how much weight could one put on their new joint?
That's an excellent question. See, again, people say if you are obese, you cannot have a total knee replacement. You have to reduce weight. This is almost impossible for them. When you have a painful knee, you find hardly even walk within the house. How can you expect them to, be very active and to shed their weight and come for the knee replacement? So the ideal knee is, and again, a solution for that. Here, even an obese patient can undergo, a knee replacement, because as I told, the polyethylene which is used in this kind of surgery can withstand, even a morbidly obese patient. But the advice will be, after the surgery, enjoy your life, but don't gain abnormal weight.
So, would that mean, doctor, that one should follow a special diet pre-operative and or post-operatively?
Not necessary at all.
So, doctor, you mentioned the advantages of the ideal knee replacement surgery. Now, just to clarify, uh, what are the signs that something could be wrong with the new knee, and if any, how could they prevent any problems from happening to the new knee?
Okay. See, basically, if the surgery is performed well, I'm sure they are very unlikely to face any problems. And the only concern is if these patients fall down, they can rupture the ligament, or they can have some fractures. So that's all a complication of the procedure we can expect. Apart from that, by default, there are no such concerns.
So, again, doctor, how long would the artificial knee joint last, and will ever one require a second knee replacement?
Well, so you're asking me about the revision surgeries?
Right.
Yeah. Well, if a conventional knee replacement or where the fixed platforms are used, I would say average lifespan could be around 15 years. But whereas when you use the latest technology with the rotating platform knees, which we do in the ideal knee replacement, it is definitely going to last more than 25-30 years, which has been proved already clinically. We have evidence for it. So that is why when I combine a plan which is going to last more, and surgical technique which is going to give the patient a fast recovery with negligible pain, it becomes an ideal knee what they are searching for.
So, doctor, how are the ideal knee replacement surgery facilities and quality of treatment in India compared to the other countries?
Well, I think we are at par with any international, internationally reputed hospital across the globe.
Doctor, and is the ideal knee replacement surgery costly in India compared to the other countries?
That's a fantastic question. I would like to answer. See, the present government has done a great thing to the patients. The implants what we are using for this ideal knee replacement used to cost quite a, I think it was almost around 3 lakhs, 2.5 to 3 lakhs, the implant alone. But because of the restrictions on the implants now, we get this advanced technology at a very, nominal price. So I would say it is much cheaper in India now than in any other country.
So, doctor, what are the facilities and treatments available at Apollo hospitals for ideal knee replacement?
Well, as I told, we have all the technology to provide that. You name the implant which is there, and we have the surgical expertise to do the approach, and also the implants are available, and we have the computer navigation to house the implant. So we have all the technology with us to do it.
Doctor, just to share with our audience, any challenging cases that you would like to share with us that you have faced, doctor?
Oh, well, as a surgical, in the surgical technique, not every knee is going to be the same. There are quite a few challenging cases we have done. The challenges are in different, phases. Like, we advise patients, they don't bother about the morbidity. An interesting episode, I saw a patient, morbidly obese patient, who has to undergo the knee replacement. She didn't have any other choice, but she was not willing because she was afraid of the procedure, and she wanted to go and live with her children in Canada. And after a few days she comes back to me saying that, well, doctor, I want to have the knee replacement. What happened? I asked. You were vehemently refusing to undergo the procedure. No, what happens, the Canadian government says, unless otherwise I have the knee replacement, I will not be given the visa. So come on, let's have the procedure. So it was, it's definitely a challenging case. She was weighing around 150 kilos, and it's an obese patient. Technically, it was much more demanding, and she had a very bad deformity. I still remember, and her legs were completely bowed. Uh, Completely bowed legs, and she could hardly walk. She was wheelchair bound, and she has never walked over 3-4 years, and it was quite challenging. And I was pretty happy and satisfied, and she visited me after the surgery 2-3 years later. She's still living with her children there happily.
That's great, doctor. So, doctor, now while we enter the fag end of our interview, uh, just to let our viewers know, so how does one keep their knees healthy?
Good. Well, the most important thing is, don't gain weight. The obesity is one of the major drawbacks for the knee. When you're obese, you're bound to have an arthritis at the early age. One, and second thing, be active. You should walk every day at least a couple of kilometers. That keeps your knee healthy. People think, on the contrary, if you walk more, you will develop arthritis. This is absolutely wrong. you should walk more, and because of that your bones around the knee get much more stronger. And if you have any minor injuries in the knee, don't ignore, because one of the main reasons for the younger population to have arthritis, around the ages of 40 or early 50 is knee injury which was neglected. So if there is a minor injury, attend to it so that you will avoid arthritis at an early age.
And doctor, finally, what would be the most important bit of information you would like to give to our viewers watching this session?
Good. So I would like to emphasize again on this only. If somebody who is waiting for a total knee replacement should definitely be aware of ideal knee replacement. Once again, I would like to emphasize, this is ideal knee replacement is not something which is ready on the shelf, everybody can do. It is a concept, it is a philosophical evolution, where every search and every concern of the patient following a total knee replacement will be addressed in this.
Thank you so much, doctor.
It
has been an extremely informative session with Dr. Lennon today. Thank you very much for your time. For appointments and consultation, please get in touch with Dr. C. Lennon, consultant knee replacement and arthroscopic surgeon, Apollo Hospitals, Greaves Road at 740-111-4659. I repeat, 740-111-4659. Thank you.